Welcome back to my channel. Today I'm going to talk about 6 alternative nursing jobs to get you out of the bedside. Number 1 is IV hydration nursing. I think this one is really cool. So you work in oftentimes like a spa type setting, and people come in for hangover cures or for like energy boosting hydration, immunity boosting hydration. There's all kinds of different therapies. So you as the nurse, you're going to educate them on the different therapies. You're going to insert their IV, administer the therapy, and monitor them and send them out after 40 minutes or an hour. So relatively low stress because you're working with a healthy population. You're not dealing with life or death every day, which is definitely like a breath of fresh air coming from a hospital. And you also get to work during the day. No one's coming in for a hangover cure at 2 in the morning. You are working normal daytime hours, Monday to Friday, which is really nice for your work-life balance. According to Glassdoor, the national average salary was $79,000. I applied for one of these jobs like a few months ago, and they offered me $35 an hour, so not too bad, definitely like comparable to a hospital. Number 3 is school nursing. School nursing can offer really nice work-life balance because you're on an academic calendar. You're getting summer break, winter break, spring break, snow days. You're working during the day, no weekends, no nights. But it can be a little stressful because you are the only provider in that building. So if there's an emergency, you are the one everyone turns to, which can be a lot of pressure. The average salary, according to Glassdoor, is $58,000, so definitely less than a hospital. But you also have summers off, so a lot of nurses will be like camp nurses in the summer or nannies to bring in some extra income. Number 3 is outpatient nursing. Outpatient nursing is kind of a nice option because you're keeping your clinical skills fresh, you're still doing assessments, taking vitals, working with patients directly without the stress and the crazy hours of a hospital. Outpatient is also a really nice option for new grads because a lot of outpatient clinics take new grads. You only have to have an ADN or a BSN depending where you go. But it's kind of nice because you don't have to like pay your dues in a hospital if you don't want to do that. You can just skip straight to that nice 9 to 5 work-life balance. Number 4, public health nursing. So public health nursing is way more involved in your community, and something I recently learned is that they have different specialties within public health. So I looked at a job posting today just out of curiosity for a communicable disease public health nurse. So for that position, you're doing tons of like infection control. But I also applied to a position a few months ago for women's health public nursing. So you're doing STD testing, education, birth control education, working with newly pregnant mothers. So that's kind of a nice option to be able to specialize in that kind of a setting. Again, this is going to be a Monday to Friday, 8-hour shift job, no weekends, no holidays, no nights. The average salary, according to Glassdoor, is $73,000, and a lot of these jobs want you to have either an ADN or a BSN plus 1 year of clinical experience. The next one is telephone triage nursing. This one's really nice because you're working from home a lot of the time. You're working for a virtual call center, so you're kind of assessing and evaluating and sending patients to the right level of care. I think you need to be really experienced and really comfortable with your assessment skills if you want to do this, because you need to be able to know what's going on with your patient over the phone, which is really hard if you're not looking at someone to be able to determine what kind of help they need. So this job requires a lot more experience. The job I looked at today required 5 years of experience, with 1 year being in pediatrics. The salary for this one is a bit higher. According to Glassdoor, the national average is $84,000. And last but not least is my favorite, which is tech nursing. I work in tech, so this is kind of a new and evolving field, so I couldn't find a lot of statistics as far as like average salaries, qualifications, but I'll just tell you like what I know from my experience. So my company has a health and wellness app, and basically we have like a live chat, so our members will write into the chat. So if they come in with a question that's like remotely medical, then I'm the person that's consulted. I will do some research, find some evidence-based articles, and then like summarize it in a way that's easy for them to understand, and I send it over to them. I get paid $31.25 an hour for this job, which is less than a hospital, but I get a $5,000 bonus every year, assuming I like do my work well. And with that bonus, I'm bringing in a similar amount I was making in the hospital. In summary, you don't have to work at the bedside for the rest of your life. There are so many other options outside of the hospital that pay well and will give you such a better work-life balance, so don't limit yourself. If you enjoyed this, let me know in the comments, and I look forward to seeing you again next week.